Work. Okay, so now we're going to go into the treatment of turf toe, which is going to be the same treatment for osteoarthritis. Turf toe is just an acute injury, whereas osteoarthritis, we're going to have a chronic repetitive wear and tear of the joint. So what I like to do, of course, we want to restore proper function in the hip girdle and the core if there's any motor inhibition. I like also inserting T10 to L1 prior to doing anything local here, and for about 10 minutes. And then I have the patient lay supine. So what I do here, first I want to mark the areas that I'm going to needle. Okay, so we're going to use a surgical pen, we're going to use an eyeliner, and I find spleen 3 and spleen 2. And in the middle, we're going to feel for the joint line of the great toe. So once we find that joint line, which is, a lot of people refer to it as spleen 2.5, which is pretty much right in the middle, we're going to feel, and we're going to feel a little divot. We want to mark that divot, and because that's where we're going to be placing needles in a transverse technique to cover the joint line. That's where most of the irritations has taken place. So I recommend, we've already swabbed the points with alcohol, so I recommend using needles that have a metal tip so we can connect the stim unit easily. So the first point we're going to do, we're going to find the joint line. Once we find the joint line, we want to move from the inferior to superior in a transverse fashion. And then we're going to go, we could do several ways. We could do a couple just going in the same direction, or we could go from inferior to superior and then superior to inferior to cover the joint line. So again, you want to mark first that joint line. I haven't done so here, but in your clinic you want to do that. We're going to needle also spleen 3, liver 3, and any kind of other adjacent points that you feel is appropriate. We can also needle spleen 9 as well to stimulate the nerves that supply the area. Once we insert these, we connect. These are a little uncomfortable. And you want to warn the patient. Again, once you cover that line, we come in with the electric stim. And we want to stim these 2 points. Of course, I like stimming spleen 3, spleen 4, liver 3, especially if a patient has a bunion. Spleen 4 and spleen 3 are great points to needle, or Usher points on the abductor hallucis muscle. This is a great point to add into the treatment if someone has like a bunion or the toe moves medially. Liver 3, and then we're going to stim the area to cover the joint line, which most of the injury has occurred, most of the degeneration in the osteoarthritis, or a sprain in turf toe.